November is Diabetes Awareness Month, and Oprah's fitness guru, Bob Greene, has written a brand new guide for the 24 million Americans who are living with diabetes. It is called The Best Life Guide to Managing Diabetes and Pre-Diabetes, which is also very, very important. Always good to have you here,
It's great to be here.
I know this is an important book, and this is something that has hit close to you.
Really is. I have both parents have diabetes, live with diabetes, and pre-diabetes, we mentioned before, that's 57 million people have pre-diabetes. And the amazing thing is, those are the people we know. So there's a whole lot of people that haven't been tested or avoiding having their blood tested and just don't know that they have
And let
a
people,
condition.
when you're pre-diabetic, your blood sugar is above normal, but not the diabetic stage. And it's really happening a lot, like 1 in 4 Americans over the age of 20.
That's right. And they say, a new study came out that if we continue on this path, a child born today has a 1 in 3 chance of having diabetes sometime in their life.
What are the signs of being pre-diabetic?
Well, if you notice you're thirsty a lot, frequent urination, blurred vision, and fatigue would be the most common.
That doesn't necessarily lead to diabetes.
No, it's a precursor. It can and has a decent chance of developing into diabetes, but it doesn't have to. And with lifestyle modification, many people can prevent getting diabetes.
And that's where you come into play.
There we go.
Yeah, with the lifestyle modification. Your book is broken down into 3 parts. And first of all, of course, when you're thinking about diabetes or pre-diabetes, you think about sugar and the blood sugar and how to be able to know where that is.
Well, first thing is know your blood sugar, because there are so many people out there that just avoid getting tested. Get tested, find out what that is. And if you are diabetic or pre-diabetic, that's when you start to communicate with your doctor. And you also start looking at the lifestyle modifications, in particular diet and exercise, and you can manage this condition. It's serious. I want to say that it is a serious condition, but it can be managed.
And exercise is so key. It's a part that we don't really talk about.
We don't, and no one really wants to talk about it because not many people like to do it, but it's really effective. It changes our sensitivity to insulin, and that's what diabetes is. It's really a problem of insulin not being as active as it should be.
But you said diet is also key here, and so you have some samples here of what a full day of meals would be like.
And so many people think, oh, you have to be deprived. It's not at all. In fact, you're seeing a lot of comfort food. This is a steel-cut oatmeal, and it has walnuts, and it's really wonderful. It can be paired with almonds as well. And the steel-cut tends to have a lower glycemic than regular oatmeal. Moving on, this is a white bean chili with skinless chicken, so it's very comforting. Notice that the bread, we get into trouble when we use white bread. There's no reason anymore. The whole grains are so prevalent, and they're really delicious. And this is a ground turkey casserole for dinner.
Oh, so I couldn't determine what that was.
Yeah,
it's ground turkey. It looks delicious, though.
Yeah, low in fat.
Very good.
And obviously, diabetes, people think, oh, it's the diabetes that is the problem. Sure, it's a problem, but it's really the things it puts you at risk for, like heart disease, stroke, eye disease, kidney disease.
Okay, the cupcake, though. You know, people are thinking, come on now, Bob, how can you have a cupcake and be diabetic?
You can. Obviously, look at the portion size. It's smaller, and we reduce the sugar. So that's a special cupcake, but still delicious, and it's a great treat. And just because you have diabetes doesn't mean you can't treat yourself.
No, and you should. And so you have all of this in your brand new book to kind of give us just the lifestyle modifications. You don't have to deny yourself. How do you stay motivated?
Well, I'm a self-motivated person, but I had a family late in life, so that takes it another level for me. My kids really want me to push me to be a good example and to live the lifestyle so I can be around for them.
And you want to be here for them. And your folks are doing well now?
They're doing well, yes.
Good. All right, Bob, thank you so much, as always. And again, you don't have to deny yourself. You think that you do when you're on a diabetic or something like that, but you can still eat well.
It's about managing your life.
As always, and you're the man to do it. You can read an excerpt of Bob's book and get all of his recipes on our website at abcnews.com.